Okay, so we're going to go over foley catheter peri-care. Very similar in principle to non-catheter related peri-care, but we'll just kind of show it so that it's clear. So again, similarly to peri-care on a client that doesn't have an indwelling catheter, you're going to want to know and obtain the supplies that your facility uses, whether it's a basin and soap and warm water, whether they use the spray cleanser or the Sage or other brand of shields, for example here, the peri wipes. So we'll say we're going to use the wipes just to show, so we'll get those ready, and we're going to perform hand hygiene and grab gloves, of course, before starting. You want to make sure, especially with a client with an indwelling foley, that you're doing peri-care often, so at the very least BID and then of course PRN throughout the day if they are, say for example, incontinent of stool, or if they have excess discharge or mucus that kind of collects on the catheter, because as you can probably imagine, that tube puts them at high risk for infection if germs and microorganisms can sort of crawl up into their, or move up into their bladder. So a couple other principles with the catheter, we want to make sure that we keep the drainage bag below the level of their bladder, and we also want to make sure that it's attached to a non-movable part of the bed. So for example, you don't want to have it on the side rails because if somebody releases the side rail or drops it down, it could pull on the person and be quite painful or actually detach, which would leave you with an open system, which is also not good. So you want to put it on a spot of the bed that's not going to move. And when you kind of get under the bed and look, you'll see there are some areas where you can attach it to. You also want to make sure that you're emptying the foley and recording at least every 8 hours, or if needed, a little bit more often. So we're going to get started and we're going to do some peri-care around the foley. So we'll grab our gloves here. We have our wipes. If our patient was wearing a brief, we definitely would want to bring in a new brief. He does have a incontinence pad underneath him, so presumably he's incontinent of stool. So we're just going to uncover him and ensure privacy as much as we can and warmth. And we're going to take out our wipes here. So we're going to, again, just like with peri-care, we're going to start at the urethral meatus and go around. And we're going to clean the tip of the penis and then down. Especially you want to be careful if there is stool contaminants on there, that you're not getting them on your gloves and then sort of spreading them around. So if your gloves do become contaminated, you're going to want to throw them out and get new ones. So we'll just throw this in the garbage and get a new one. And you want to use, you can kind of fold your cloth so that you can use a new side of the cloth for each wipe. We're going to want to stabilize the catheter here so that we don't inadvertently pull it out. And we're going to clean down the catheter away from the patient. So now I'm going to switch to a clean side of the catheter and do the rest of it. So you would want to do that until it was clean. And then again, you can grab a new wipe and clean around their groin area if it was contaminated. Being careful not to move contaminants onto or near the catheter. So we'll just show, for example, with a female now. So for a female, similar principles again to peri-care, but we just want to be mindful of that catheter that's there. So we're going to start here at the outer labia and go down, and you're always going in the direction of top to bottom, so towards the anus. And if there is a clean portion of the cloth that you can use, you're going to do the same on the other side and go down towards the anus. And you may need a new cloth or wipe at that point. And we're going to do that throughout in the center. Again, new cloth or a new portion of the cloth. And we're going to actually stabilize here and clean the catheter tubing if it became contaminated with anything. So again, moving in that direction away from the patient, so you're not bringing any contaminants up towards the patient's urethra and eventually into their sterile bladder. So those are the main principles. You do want to be careful when you're doing it that you're not advancing the catheter in any way again, and you're not tugging too hard, pulling out. So just keeping those in mind, and that's why we're stabilizing whenever we're doing anything that's sort of on the catheter itself. So that's it.